Now, after all this sweet talk, let's bring in Dr. Treva Lee. Hello, hello.
Hi, thank you.
How's it going? Nice to have you finally. Now, doctor, how long have you been a dentist?
Well, I've been helping Central Valley residents help their smiles of all ages for over 25 years now.
Wow. Yeah. Did you grow up in Fresno?
Yes, I did.
Really?
I'm born here, went to school here, went to Bullard High.
You're a Bullard Knight?
Yes, I am. Go Knights.
Yeah.
Took classes at Fresno City, Fresno State, and then I was fortunate to be able to go up to Cal, get my undergraduate degree in nutrition and food science. And then I'm blue and gold all the way through, got to go to UCLA Dental School.
Nice.
Came back to Fresno.
Now, if you've been doing this for 25 years, things have changed a lot in the dentistry world in 25 years. Let's talk about that.
Well, you know, we started out with, you know, the hand pieces, you know, the dreaded drill, and now we've moved up to a lot of things like air abrasion. They're using lasers. It's very Star Wars.
What do you mean air abrasion? The air chips away the tooth with air?
Pretty much, you know, and it works for certain situations, not everything. It won't take off old fillings and old restorations, but it works really great for, you know, brand new cavities when they're small, and that doesn't require as much anesthetic, you know. People are very concerned or scared of the anesthetic shot.
I'm not. Bring it on.
Yeah. So we can minimize, which brings us to the other thing where a lot of times I'll do oral conscious sedation. Someone who's really scared of going to the dentist, or they just want to get a lot of work done in a small amount of time.
And it's just easier, right, for you to have them knocked out.
Yeah. They're just relaxed. They're not totally knocked out.
Do you do cosmetics?
Yes.
Surgery? Is that what you? Okay. So
yeah. It's a lot of fun. A lot of people think cosmetics. I mean, that's what everybody sees. But really what I enjoy is by making it look better, they're actually getting healthier. So everything's a lot better for them overall. So.
Expand on that a little bit. They're just,
they're
getting healthier.
Well, for, you know, physically it's easier to chew because if you're missing a tooth or you have something broken and it's hurting, you're not going to chew on that side. So now you're going to be out of harmony with how you bite and stuff, and you're going to only chew on one side. You're maybe going to make food choices like, oh, I'm not going to eat that fresh fruit and vegetable because it's a little bit tougher. It hurts when I bite on it.
Will it change your face?
It can.
It can, huh?
Yeah.
Because you're chewing more on one side?
Yeah. So develop, you know, it's just like everything else. You use one leg more than the other. Maybe that hip or knee is going to go. Sometimes people have problems with their jaw muscles and stuff because they've been kind of out of balance and stuff. So
I know a few people I'd like for their jaw muscle to go. How about you?
And then with kids, that's what's really important. A lot of people think, oh, they're just baby teeth. But they're the teeth there, so they learn to speak, they learn to chew, their jaws and everything develop normally. If you take teeth out, the bone does reshape. So that's not something we want to see.
And they'll enunciate differently.
Exactly.
Right?
Yeah.
Now, people don't believe this, but I swear, and you can probably back this up for me, this is my third set of teeth that grew in.
You're like a shark then.
Yeah, so people don't believe me, but it's possible, right?
I've had patients that have actually, you know, they talk about wisdom teeth, third molars. I've actually had a group of family where they've had fourth molars.
Wow.
So it happens.
Fourth molars.
So everybody, you know, human beings are remarkable. They get all sorts of different things going on.
Thank you for verifying that for me. Now you guys can stop teasing me. Now, you brought some pictures with you. And are these before and after type pictures?
Yes, they are.
Okay, great. Let's go to the first one right here.
This one is of a gentleman that he, long time ago, had an injury doing athletics. Tooth turned color. He was always very embarrassed and self-conscious about it. So we actually did some whitening, and then we did a veneer, which is like a half crown. This is a young lady where...
You say half crown, so this is just on the front?
Exactly. So we don't have to take a lot of tooth structure away for that.
Okay.
This is another young lady, very self-conscious about her front teeth. You can see how she had stain, chipping. She'd had several fillings placed and replaced. Again, we did something similar, whitening, and then placed crowns. If there's too much tooth structure missing, then we try to reinforce the tooth with crowns.
The whitening stuff that you find on the counter at the supermarkets and drugstores, are they good for the teeth, bad for the teeth?
They're over the counter.
Do people overuse them sometimes?
Some people, you get concerned because if they have other things already going on, it can irritate it. If they already if they already have existing cavities, that's not going to help it. Or if they have gum problems, that's going to only irritate it. It's over-the-counter strength, so it means it's weaker. So you may end up thinking initially it's inexpensive, but if you have to apply it 2 or 3 or 4 or 5 times, then really you would have saved yourself money getting the regular what I call prescription strength from someone like myself,
Right.
and you get results much quicker.
Now you
So-
do the teeth whitening,
Yes.
right?
Yeah.
And it's an easy procedure.
It's
it
so
doesn't take
simple.
long,
Yeah.
and at these days it's not that expensive, is it?
Yeah. We do at my office something called Whitening for Life. When you're a patient of record with me, every time you come in for your cleaning, you get a free touch-up gel. So we start you off at $99, and you get the custom-made trays, the gel. You stick it in the refrigerator, it lasts a while. So if you've got like a family reunion coming up, you can do a little touch-up. So every time you come into my office, you get touch-up gel as part of the whole situation. So that's kind of win-win, because then we get to
Cool.
check you, make sure everything's healthy, and you win because you get the touch-up gel and you're not having to buy refills and stuff like that.
What are some of the common things that people neglect that you see that they could have easily taken care of at home?
A real common thing is, people will brush, or maybe they floss, only when they've got corn on the cob stuck in between their teeth. But they, rinse and spit, and they go, oh, a little bit of red, a little bit of blood. Oh, no big deal. Which I always tell them, if you were washing your hands and it didn't hurt, but all of a sudden you saw blood, wouldn't you be freaking out and running to your doctor and figuring out what's going on? So that's a warning sign. Even if it's not hurting, that's the initial signs that you've got something going on with your gums, an infection. And sometimes there's underlying things that are going on. You might be anemic, you might be pre-diabetic. Things like that show up in your mouth first before they even show up in the rest of your body.
Why is that?
Your immune system is just trying to fight off little things. So if it fails to fight off little things, then when the bigger things come, like maybe getting a strep throat, getting flu, maybe even something worse like pneumonia, your whole immune system's down. So having a little gum infection is like a little telltale warning sign. So it's just like when people start to get a little rash, like maybe their skin's not really clean or something's irritating it. They've leaned up against something that's irritating. So that's like a little warning sign. The little bit of bleeding of the gums is kind of like a rash. It's telling you something's not quite right, something's not quite in balance or healthy. So
Now, people that are looking for a new dentist, are you taking new patients?
we absolutely are.
Okay. I know that they can find you on Facebook.
Yes, I am
You're
on
pretty
Facebook.
active on Facebook
It's
for a
kinda fun.
doctor.
Yeah.
Right? And how else can they find you?
My phone number, 559-226-3010. And I always have somebody answering the phone. It'll either go to one of my team members' cell phone, go to her voicemail, or if it's a real emergency, my cell phone number is on my answering machine, so my
Okay.
patients can get a hold of me
Awesome.
all the time. If it's 3 o'clock in the morning, I might be really slow answering, but I will get back to you.
That's cool.
Got a website. I am on Facebook, so search for me there. It's a lot of fun that way. So.
Well, thank you very much for coming by. It's
Thank
nice
you.
having you.
So-
Now, we're going to take a quick commercial break. Make sure you stick around because we have live local music from the ukulele king of the San Joaquin, Peter Mordike, coming up, and a lot of giveaways still to come. Stick around. We'll be right back.
Thank you.